evening and welcome to Halton News Live at 5. I am Melissa Candelaria, your anchor for tonight, filling in for Jessica Kading. As we continue into the second wave of the COVID-19 pandemic, a counselor in Halton Hills with a background in healthcare is worried that we may see similar outcomes from the first wave, if not worse, when it comes to long-term care and hospitalizations. With the number of active cases increasing, especially in the 80-plus age range in Halton Hills, Councillor Moya Johnson is criticizing the government's handling of the healthcare system. With 40 years' experience in healthcare as a nurse and planner herself, Johnson says one of her biggest concerns is long-term care in her community.
I think that was badly handled, and there's already outbreaks again in long-term care. I would hate to have a family member in there right now. I'd be very worried because I don't think they have the resources they need to provide the kind of care that people need during a pandemic, which is full-time staff that are trained and know how to care for people and how to protect themselves and also the clients or the residents from catching the virus, how to keep it out of the building. For instance, they've recently opened up visiting for long-term care so that people can go and visit their family, their mother or their father, but they need a negative test to be able to go. Well, now they can't get a test, so they can't go and visit because they need a new test. I believe it's every 2 weeks, a negative test. So there's the people in there that don't see their family, wonder perhaps if they have some memory issues. Where's my daughter? She hasn't come to see me and she can't go. And FaceTime, for really older people isn't it's good for you and I to meet this way, but not necessarily for people who don't understand why someone's not there. So long-term care is a huge issue.
Although there has been less hospitalizations so far, Johnson says it doesn't mean people should be dismissive of this second wave, as the healthcare system is still dealing with the ripple effects from the first one.
Hospital capacity, there was a lot of canceled surgeries, cancer treatment, prenatal care, things that go on in the usual healthcare system that were totally stopped during the pandemic, thinking that we need the hospital capacity for COVID patients. Now, luckily, the healthcare system survived that, but already, if you listen to the physicians, the infectious specialists are saying, we've got to do something. We can't just say we've got hospital capacity because we can't shut down again. The waiting lists are huge for people who need other care. And if we get back into that situation, it's not good for people who aren't getting diagnosed with cancer, aren't getting mammograms that, are delayed 6 months. And that might be the difference between survival and not survival. So, the healthcare system is fragile, and we can't just say, well, we've got lots of capacity now, so it doesn't matter if people get sick. It really matters, and it matters for every person because people are still dying.
And as I said earlier, the number of cases is increasing slowly in Halton Hills. If we take a look at today's numbers, 15 active cases there with 11 reported deaths. And again, as mentioned, the biggest demographic in that community are those in the 80 years and older range. Now, sticking with North Halton, Milton is dealing with 32 active cases and 4 deaths, 389 total cases, which is an increase by 5 since yesterday's update, 361 of which were confirmed. Oakville's cases went up by 11 to 597 total, 70 of which are active, and 3 reported deaths. You can also see the hospitalizations up there as well. Burlington with an increase of 13 to 425 total cases, 95 of which are active, and 9 reported deaths. Now that brings the total of 1,640 cases right across Halton, 1,527 of which were confirmed, 212 active, 27 reported deaths, again, right across the region. Now I know that is a lot of numbers to take in, but for my next guest, Burlington's numbers, of course, have particular interest. I have Mayor Marianne Mead Ward joining us to discuss more about COVID and the COVID response in that community. An update, if you will. Thank you so much for joining us.
Great to be here. Thank you. I wish we weren't talking about COVID-19. I think we all wish that. But yes, we have to deal with the increase, and it's very troubling.
It is troubling, and let's talk about that too. You know, obviously you can only speak to your numbers here. Now, the demographic, if you recall, obviously in the beginning of this pandemic, and in particular in Burlington, was the older demographic. Now that demographic has shifted a little bit to younger, about 20 to 59. Talk about that. What do you think? Why do you think that is in Burlington?
Well, we actually have just gotten information from our medical officer of health, and about a quarter of the recent cases, the significant recent cases, have been tied to outbreaks in long-term care. So we are still seeing that group of seniors that may have multiple, medical conditions that weaken their ability to fight off COVID. We have to be really, really concerned about what's happening in those facilities. So I've certainly kept a close eye on that. I've reached out to our medical officer of health for guidance. They, of course, handle any action that's taken in those homes, but we really do have to be very careful for folks visiting their family members in long-term care. Be careful. Follow the precautions. We cannot let our guard down for a minute. We also have received some recent news from our medical officer of health. There will be some communication coming out very shortly, later today, possibly tomorrow, about the source of some of the other outbreaks in Burlington. So watch for that, and watch for some updated recommendations and follow them. We all have to follow the recommendations from our medical officer of health here and at the province, and of course do our part. And that's keeping 6 feet from people you don't live with, wearing a mask, frequent hand washing. Please continue to do that. We are nowhere near out of the woods, and our numbers are higher than they've been throughout this pandemic.
Well, and speaking of that long-term care, like a couple weeks ago, there was a report of 2 deaths in one of the long-term care facilities in Burlington. And also the story that we just watched previously, we had Halton Hills talk about their concerns of long-term care there as well. We talk about being careful. You had just mentioned we have to do our due diligence, but is there more that, Burlington, yourself and council is trying to do, that we need to be more active? The government needs to do more in order to protect these most vulnerable people?
Well, I think we are all trying to do our best here. And of course, Burlington City Councillors sit at regional councillor, but we take our direction from the medical officer of health, not the other way around. And that's what you want. You want the health experts to be directing the care in all of those facilities, and they are and will do that. But we need the individuals, we need members of the community to follow those rules and follow the advice. And it will be spread if that's not happening. So please do your part. That's the strongest message I can send. If you are sick or think you are sick, if you've received a ping on your COVID app on your phone, and if you haven't downloaded it, please do. Stay home, self-isolate. You've heard this throughout this pandemic, and we need people to do this as much as we also want to connect with family members, especially family members in long-term care. Please don't, if you are sick or think you might have come into contact with somebody with COVID, and that includes staff as well as residents. They're our most vulnerable folks, and this virus has no way of getting in those homes except people bringing it in. So please do your part, and certainly the regulations are there, and our staff are working very hard to ensure that this doesn't happen.
But are you getting a little, I guess, fatigued by having to keep reminding your residents this? I mean, we are still seeing people not following these rules. Of course, I don't know if there was any cases in Halton yet of violations, but certainly in Toronto there was. As I said earlier, I mean, the demographic is now younger, despite the most recent findings of it being in long-term care, is getting into the younger demographic. So, I mean, as much as you're saying do your part, people are still not following those. What else can we do? What else, is there anything in the works that we can do more? Enforcement, things like that, for people to really get that message?
Well, certainly in Burlington, we usually take a education first approach to bylaw enforcement. That period has ended. The message has been out there for months and months now, and so we will issue tickets if we need to. But that is, that's the last resort. That catches a handful. I will never get tired of fighting for the community and fighting this virus and spreading the message of what people need to do. I think folks start to feel like they're immune because the numbers were so good for so long. A month ago, our active cases were at 11. They're over 90. So we can never let our guard down. Any of us, as much as we've been in this for a long haul, it's going to be even longer if we let our guard down. So please, I will continue to say that message. I will never get tired of saying that message. As long as COVID's with us, you're going to hear me talking about this. And do your part, because without you, all the legislation in the world isn't going to matter a bit if residents aren't following it. So we need you to do that.
Now, we are running out of time, but I really wanted to get this in. Now, in terms of testing, there has been some issues and some maybe criticisms over appointments, especially with Joseph Brandt. I know there was some residents who had a hard time booking appointments and getting calls back to get their appointment in. Is there, have you had any talks with Joseph Brandt Hospital in terms of maybe revamping their appointment system to be more like Halton Healthcare's, for instance, just to kind of deal with the backlog of numbers? And as you said, with long-term care, people are trying to get in, but they need to have a negative COVID test before they get there, right? So has there been any further discussions on that?
I'm in regular contact actually with the hospital, with our MPPs, with our MPs, with almost daily, but very regular contact. But it's really important to understand that the testing protocols are set province-wide, and the backlog is province-wide. And what we've seen is people making multiple appointments to see which jurisdiction can give them the fastest test. And at Joe Brandt, we have seen 40% of people not keep their appointments. That has got to stop. If you don't need it, cancel it, because that's 40 out of 100 people that weren't able to get a quicker appointment. So don't do that. And that's happening, as I said, across this region. I've heard of stories of appointments taking a while. And of course, the testing results, again, provincially mandated labs. We're standing by at the city to open up Nelson Arena to have tests for asymptomatic folks. We were just about to go, and the province stopped that when they initially ended asymptomatic tests. So we're ready to go. We've got the pandemic response unit at Joseph Brandt for any overflow of patients, whether from Burlington or any other jurisdiction. We just need the green light from the province that the capacity is there to start doing those tests. And if it is, we're ready to go too.
Okay, well, I want to thank you so much for taking this time. We've run out of time. We could probably spend a lot more discussing just COVID alone, but thank you so much for taking the time to speak with me today.
You're very welcome. Thanks for having me on.
Okay. Again, that was Marianne Mead-Ward, Mayor of Burlington. Now, the Milton Chamber of Commerce is looking for your input. In partnership with the Ontario Chamber of Commerce, the Milton Chamber is looking for your insight on what matters right now as we continue to deal with this pandemic. The survey will take a deeper look into business confidence and other issues regarding Ontario's economy and recovery, and what your organization's outlook is for 2021. If you haven't received an email from the Chamber yet about this, you can just head on over to their website at miltonchamber.ca. Okay, we're going to take a short break right here, but more local news after this. You don't want to miss it. Welcome back to Halton News. Again, I'm your host, Melissa Candelaria, filling in for Jessica Kading. Many people have started new hobbies or projects while they can't get out of the house during social distancing. It seems the pandemic lockdown was just the push for this Oakville resident. What he needed to start a project he's been thinking about for years. Nikki Wesley has that story.
Oakville's Clayton Terrio studied print journalism, but partway through his education, he decided writing for a company wasn't for him. 2 years ago, he decided he wanted to do advocacy work for the disabled community, but he was nervous to begin.
Obviously, throughout my life being disabled, I noticed the, I guess, not necessarily discrimination, but just the disabled people kind of get left on the back burner. And I was having a discussion yesterday in my interview, a woman with 3 children with autism, and she says the system basically is almost like when you turn 18, you're cured, and you have to reapply for funding, everything. And then when COVID hit, I kind of realized, well, seniors and disabled people were left off. Like, all the major governments, whether it's the states, overseas, whatever, here, no funding for disabled people. So I figured, well, what better time to start something?
In early April, he began his YouTube show, Hot Seat with Cognizant Clay. He's featured an incredibly diverse group, including a Muay Thai practitioner with a prosthetic leg, former Lieutenant Governor David Onley, Olympian Alexandra Bilodeau, whose brother has cerebral palsy, wheelchair designers, and the list goes on.
Like, just anything and everything, because people might not know that these wheelchairs exist, or that a program for an autistic child exists, or adaptive equipment for doing interviews like me, or whatever. So I just like to focus on advancements, but also to give people the information that they might not know exists. A lot to do with employment, because disabled people don't really get jobs very often. And it's kind of, I think it's a crisis personally that people don't really realize is a crisis.
One of his interviews was with Rocky Stoutenberg, who's completely paralyzed from the neck down. He's an accomplished gamer, playing under the handle Rocky No Hands.
He uses a quad stick, which you game with your mouth. It's inhaling and exhaling, and you move your neck to move your guy if you're playing a shooter. He is one of the best in the world. Like, he plays Call of Duty, he gets like 10 kills a game. And he uses his mouth. It's incredible.
He's spoken with Paralympians to highlight all the things that they can do.
They're not disabled even in my eyes. Like, yes, they're disabled, but they're more than that. Like, they don't let it define them. And that's what I try to tell people I meet who are young with disabilities. Like, don't let it define you, because they're athletes too. And I guarantee you there's an adaptive technology out there that can make people succeed. Like Stephen Hawking, complete, like, apart from his mind, physically a vegetable, basically. He can't move, but he was like one of the smartest people to ever live. He had the little voice thing that went off his brain waves. And like, there's something for everybody, whether you're completely paralyzed or your leg got amputated as a baby. Like, it doesn't matter.
He interviews parents with disabled children as well for their perspective, and other allies, including Rick Mercer.
He made his cottage completely accessible. He's completely able-bodied, but he's an ally of the disabled community. So I wanted to shine a light on that, to show that just because you're not disabled doesn't mean you can't support us.
At the age of 9 months old, he was diagnosed with Duchenne muscular dystrophy. It's a degenerative disease, and at the age of 12, he discovered he could no longer walk.
As the disability progresses, I just want to show people how it works. And to be honest, I'm not scared of the disability progressing, because, you know, I'm alive, I'm happy, and that is what it is. My mom always taught me, like, no one wants to hang out with miserable people, whether you're disabled or not. Like, you need to learn to be happy with what you have. And that really, really taught me to, you know, just deal with what you got, because you only got one shot at life anyway. It doesn't matter if you're Usain Bolt or Stephen Hawking. You can still do things.
He hopes to find a sponsor for his YouTube channel, Cognizant Clay, to help extend his reach and share his message with more people. Reporting for Halton News, I'm Nikki Wesley.
Now, there was a bit of controversy this time last year when Burlington residents had nowhere to put their loose leaf waste because of unexpected winter weather. The city of Burlington was forced to cancel their loose leaf collection, and this caused quite a stir among some residents who had no backup plan for their waste. But there's good news. If all goes well this year, the city plans to start their leaf collection on November 9th. The city also added some new features like the leaf collection hotline. And as of Thursday, you can call 905-335-7600 extension 6129 for updates. The hotline will update you on any delays or cancellations, and updates will also be posted on the City of Burlington's website and social media pages. Residents are encouraged to check the leaf collection schedule and rake leaves to the curb or edge of the pavement if there are no curbs before their pickup date. Each collection zone will have only one pickup. And just to remind you that this service is weather dependent, so things like freezing rain or snow can cause delays or even cancel the program. So the city is encouraging you to always be prepared to bag your leaves for Halton Region's yard waste pickup. And again, call the leaf collection hotline for those updates. And there's a nice shot of my hometown, downtown Milton. And although it looked a little gloomy earlier today, it was all sunshine and blue sky. And tomorrow we are going to get the same sunny sky with some clouds, though, at a high of 17 degrees. Be sure to take an umbrella with you Thursday, as we can expect some showers. A warm day, though, at a high of 19. Showers for Friday as well. Temps dipping to 10 degrees. Sunny Saturday at 11, and a mix of sun and cloud for Sunday, again at a high of 11 degrees. And here's a look at how our stocks did today. Okay, we're going to be right back. On the other side, though, an update from the Burlington Food Bank. Thanks for sticking with us. If you have donated to your local food bank this Thanksgiving season, you should be quite proud of yourself. You have helped hundreds of local families across Halton. The Burlington Food Bank is especially grateful in today's update.
This is Robin Bailey, the Executive Director of the Burlington Food Bank. And just coming off Thanksgiving Day weekend, and we just wanted to thank everyone who gave through the local grocery stores. We have a couple of drivers that go out on, usually it's Monday morning, but this week it's Tuesday morning. They went out and came back with an awful lot of food. We also had some people pick up on Saturday for us. So again, we wanted to thank the community for thinking of us, for going out and purchasing. And we also wanted to thank the local grocery stores who helped us make that happen. A lot of them put together bags, and I was just looking at a few of them. Incredible products, things that we were needing. So we really wanted to thank them for being aware of what we need and then being able to provide it that way. We also wanted to thank those people that typically are doing food drives for us this time of year and are doing smaller ones. We really appreciate it. They continue on. If you can continue doing that for us, that would be great. And we especially think of Gift of Giving Back. It's kind of that time of year normally for us, and they're not able to do it this year. But we know that a lot of the teams and a lot of the kids out there who have always been part of Gift of Giving Back are doing the hard work, and ask that you would continue to support them as they get out into the neighborhoods, looking to help us out here at the Burlington Food Bank.
And that's all we have time for tonight. For more information on our program, you can always go to our website at yourtv.tv or connect with us on social media through Facebook, Twitter, and Instagram. Be sure to also go to our website for all the updates on our programs that we have on our channel. We are live at 5 Monday to Thursday. Jessica Kading will be back for tomorrow's news. From everyone here at Halton News, thanks for watching, and we'll see you next time.